Welcome everyone to our first workshop in a workshop series on emergency and first responders partnerships. Today's workshop will be on dispatch call center diversion. Before we get started, I just want to let everyone know that if you have any tech issues during this workshop, please go into the chat and send a message to the hosts, and we'll try to address that for you as quickly as possible. If you have questions during today's presentation, please use the Q&A function to drop your question. That way we can get to it during the question and answer period after the presentation. Next slide. The views expressed in written conference materials or publications and by speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, SAMHSA, nor does the mention of trade names, commercial practices, or organizations imply endorsements by the U.S. government. Next slide. SAMHSA has selected Altarum to provide training and technical assistance support to states, territories, tribal organizations, and community partners across the 988 Suicide and Crisis Lifeline and Crisis Continuum of Care. Along with our partners, W2 Consulting Corporation and Change Matrix LLC, both of whom have extensive experience with crisis services and technical assistance, the Crisis Systems Response Training and Technical Assistance Center, or CSR-TTAC, was formed to support the continued growth of the 988 Lifeline and build a more robust crisis care system. We're so excited to have the support of our SAMHSA team. We'd first like to recognize Ms. Jill Mays. Jill is the Division Director of Crisis System Transformation for the 988 and Behavioral Health Crisis Coordinating Office. Next slide. We're also happy to be joined today by Tiffany Russell. Welcome, Tiffany.
Thanks so much, Megan. Hi, I'm Tiffany Russell with the 988 office. I am the Director of Crisis and Justice Initiatives, and I just wanted to come on and say thank you so much for joining us today for this series. We are so excited to have you. I also want to offer up thanks to Altarum for putting together such a wonderful series, and I know that it will be so helpful to all of you that have joined. We want to hear from you. We want to hear questions from you. We want to hear comments from you so that we know what information and resources we need to pull together to help you and your communities moving forward. And we're just, again, so excited to have you joining us today. Thanks so much.
Thank you, Tiffany. We so appreciate all of SAMHSA's support and collaboration through this process. We are also joined today by our entire work stream. We have quite the robust work stream. In addition to myself, Megan McGregor, I'll be emceeing the beginning of this presentation. Also joined by Stephanie Chizoba, Jasmine, Stephanie Liu, Manny, and Liz, all of whom have contributed greatly to this workshop, and we're so grateful that they've been able to support. So for today's workshop, we'll go through our learning objectives. We'll talk a little bit about collaborative response within the crisis care continuum. We'll have a great presentation for you, and then as promised, we'll get to that question and answer period. So for today's workshop, participants will be able to describe the role of dispatch call centers in crisis response and diversion. They'll be able to identify key components of effective partnership between dispatch, law enforcement, and crisis care systems. And you'll be able to apply strategies to develop and/or enhance call triage protocol, dispatch training opportunities, and cross-system collaboration in your individual communities. As we get started, we want to give you a quick note about the language that we'll use in this workshop and throughout the series. We're going to be shifting some of our language from the term co-response, which might be very familiar to some of you, to collaborative response. And the reason behind this is that we know that co-response has a very specific meaning within our first responders and law enforcement communities. We want to make sure that as we discuss these opportunities for partnership and collaboration, we're not keeping that scope small and just meaning that one type of co-response is the type that everyone should use. We want to be responsive to all of our community's individual needs. So we feel that the term collaborative response more appropriately encaptures what we're trying to do through this workshop. So if you hear that term collaborative response, we are really truly referring to a collaboration between different partners to address crisis situations. Next slide. As we know, there are three pillars in our crisis care system: someone to contact, someone to respond, and a safe place for help. Next slide. Today, we'll be focused on someone to contact, those crisis contact centers. Today's presentation will focus on that dispatch call diversion and how we take those contacts from crisis and move them to first responders and vice versa to make sure that our help seekers get the type of support that's most needed. Next slide. Today's presentation, Dispatch Call Center Diversion. We're so happy to be joined today by Sandri Kramer. She's the Senior Director of Training and Community Engagement with the D.D. Hirsch Foundation. Sandri, welcome. Thank you so much for joining us today.
Thank you, Megan. And hello, everybody. Good morning or good afternoon, depending on where you're at. I want to first start by um, saying that I am very excited to be here to speak about this particular topic. Because this is something that is very near and dear to my heart. I firmly believe that we can make positive change happen by collaborating with our partners. I've been working in this field for about 30 years now, making me officially an old person. And I have seen it happen. And so I know it is possible. And I really hope that by the end of this presentation, you feel optimistic about being able to achieve some of that. Um, while I am speaking, I also want to note that one of my colleague, my assistant program director, Shaheen Syed, is in the room with us, and she's going to keep an eye on the chat. So if questions pop up, I'm trying to not focus on the chat while I'm speaking because I'll get distracted. But if they come up throughout, she may be able to answer some of those questions. So thank you, Shaheen, for doing that. Next slide. So just briefly, for those of you who are not familiar with the D.D. Hirsch Suicide Prevention Center, this is who we are. We were founded in 1958 as the nation's first suicide prevention center focused on research primarily in the early days, becoming a hotline partly thanks to, I should say, um, the suicide of Marilyn Monroe. We're LA, so we're going to have a Hollywood angle. It's kind of throwing us into the international spotlight, and out of that, the suicide hotline was born. We were in part of the Lifeline before it was 988 since the very beginning. We've been doing chat and text services since 2012. We're one of 5 Spanish centers in 98 centers in the nation, and we are California's largest 98 center and one of the highest volumes in the country. Next slide. So the idea of 988 and the focus on crisis systems and the crisis care continuum really took shape with posing these questions. What if anyone experiencing a suicidal or behavioral health crisis could get the right kind of crisis response at the right time, anytime? What if we have more than law enforcement to respond? What if we have more than just one place to go? What if we have more than one number to call? So that's sort of like idea took shape and really allowed us to focus on what are these pillars? What does crisis system even really mean? You know, one of the things that we've started to think about and promote, I want to say probably about 10 years or so ago, is a recognition that those of us who work in behavioral health, they tend to there's not that many career paths, or there really are, but in general, as we study, people think about going to private practice, maybe doing community work, but nobody back then at least talked about crisis as a career track. That still is not necessarily happening, but I think thanks to the work and the evolvement of 988 that has been happening in more recent years, I think we may be getting there. So something for us to keep in mind as we are working our way through this presentation. Next slide. So in order for a true crisis response and care system to function, we need to work with the crisis partners in our community, which definitely includes 911. Thinking about, those of you who grew up in this country, you were probably taught at an early age, 911 is the number to call when you have an emergency. It's very ingrained in our national culture. Um, and having said that, it will, now that we have 988, it's still going to take quite some time and a lot of, I believe, boots on the ground, grassroots awareness building around 988. I'm experiencing that certainly in LA County and our primary coverage area of Southern California. I oversee our training and outreach team, and it's astounds us every time we're out at community events or doing trainings, how many people still have not heard of 988. And that's exactly why working with 911 is so extremely important because we both ultimately have a similar goal of providing support, helping people in crisis. We go about it a little bit differently, and sometimes one is a better fit than the other. Okay, next slide. So let's start with a definition, right? What is a 911 diversion as it relates to 988? So 911 diversion is a program that redirects certain types of non-emergency, but I'm pausing there because non-emergency can mean a variety of different things to different people. So we'll get back to that a little bit later. Um, Non-emergency suicide and mental health related calls away from law enforcement and into the mental health system. So instead of dispatching officers, these calls are transferred directly from 911 to 988, where trained crisis counselors can assess the situation, de-escalate, and connect the caller to the right level of care. Okay, that's the idea behind 911 diversion. Good always to determine exactly what it is, right? To set the definition. Next slide. So why is this so important? Why do we really want some of these calls to come to 988 and not send a response? Um, to kind of digest that, I'm putting it into three different things that I want to highlight here. First of all, the impact on community members, right? When you call 911 or a loved one calls 911 on your behalf, when you are in extreme emotional behavioral health crisis, could be related to suicide, could be related to substance use, could be related to mental illness. Um, do you really want a police officer to come and respond to you? What does that mean? It means flashing lights, it means loud sirens, it means nosy neighbors picking out the windows. Um, you are already in a very emotionally vulnerable state, and then this happens, right? Sometimes it comes, actually quite often it comes with hospital bills that you may not be prepared for. And perhaps a financial crisis was actually contributing to your emotional state at that moment to begin with. Once people are in hospital, even if it's for suicide, severe suicide ideation, or after an attempt, we also know that risk for reattempts go up shortly after that. If you think about being in a hospital for a psychiatric emergency, most often people don't come to visit you. You don't get the flowers and the goodies and the frequent visitors. It's sort of like it's still so stigmatized, right? So the impact on the person in crisis of a police officer in particular responding to this crisis might not be a way to de-escalate. Rather, it can escalate the situation. We also need to think about, because I often forget this, but I work so much with law enforcement these days that I am frequently reminded of the fact that first responders are humans, just like all of us, and they most likely will have friends and family members with mental health issues, maybe suicide, maybe substance use. Um, they are daughters and they are mothers and fathers and sisters and brothers to these people, and perhaps for themselves as well. These are not easy calls for them to respond to. And it's also not necessarily the primary reason why they got into law enforcement in particular to begin with. So it's an important thing to keep in mind for us to think about the first responder arriving on the scene. And then finally, a thing that's been really growing and playing itself out in our in the national community, for sure, are disengagement policies. And disengagement policies take different shapes, but broadly, what they mean is if law enforcement goes out to respond to a situation where they are not necessarily wanted and the and no crime is committed and there's no public safety issue, nobody else is at danger of being hurt, the person does not want to engage with them, they may step away. And there's even been some cases where some departments aren't even able to go out and physically respond because the moment they knock down that door, they own the situation, right? With whatever consequences that brings. And so disengagement policies are there to protect both the person in crisis and the responding first responders. Um, and with more and more of these policies taking shape as a protection, it means that the person who is in that crisis and really needs help is not getting any help, which is why it's so important that if we don't send a response, then let's at least connect them with somebody who can help in that moment, and that would be 988. Next slide. Okay, I can talk forever by just sitting on this slide alone, but here's what I want to share with you. Um, In order for successful programs like this to take hold, to take shape, it takes a lot of patience and persistence. Uh, I was clearly slightly ahead of my time because I had this notion, this idea of working with 911 uh, now close to 20 years ago. Actually, it was 20 years ago, I think. Um, and I just was like, this makes sense, right? Because we don't really need people to go out, officers to go out, situation where they're not needed and where they're not wanted and where the person really doesn't get the kind of care that they need. So how do we should be able to work together on this. Now, the idea itself, maybe it was common sense, and I definitely got some interested partners over the years, little bites from many people, various departments. Maybe go to the next slide because I think I have more timeline on there. Yeah. Um, but nobody actually was ready to do this. There was a little bit of maybe you want to call it turf protection. That sounds a little negative, but it really is had to do with liability. And no, people call 911. They need somebody to respond. This is what we do, and you just stay in your hotline little space there, right? Um, but I didn't necessarily give up on that. It's just like little bites I got every now and then. And then my friend and colleague Jennifer Battle from Harris Center in Houston um, contacted me and let me know that they just had a delegation. This was in 2016. Had a delegation from LAPD visit their center, and they seemed really interested in what they were trying to start up over there, which was um, the idea of 911 diversion with co-location model. So it's a little bit of a different model than what I'm going to be talking about. And she gave me the name of the most enthusiastic person there, and that was Captain Brian Bixler from LAPD. And as soon as I had his information, I contacted him, and we immediately were like, why hasn't this happened before? We're going to be making this happen. We're going to do this. We applied for a DOJ grant together, which we did not get at the time. Um, and we tried applying for different funding sources. It was tricky. People clearly still weren't ready. And then in 2020, it was really mostly due to the George Floyd protests that were happening all around the country, and people were talking about defunding the police. I'll never forget, I was in my car listening to a press conference on the radio by our then mayor, Eric Garcetti, who was talking precisely about that kind of stuff. And I turned on the radio and I called Brian. I said, I think this is our moment. And he totally agreed. And within 3 months, we had the funding secured. LA City said, yeah, they want to fund a pilot to do this. And we very quickly, because we've been ready for so long, very quickly moved forward and ultimately launched in 2021, February 2021. And now we are, well, it says 2025 on the slide. That's because I made the slide in 2025, but now we're in 2026. It's everybody is talking about this, and more of these types of programs are popping up, right? So I'm putting this down here. I really want to say that great, there's models out there you can follow. I'm going to talk about ours, obviously. But it's really and truly the relationship building. You look at this slide here. We started working with, particularly with LAPD SWAT, but many other police departments over the years who would take on crisis line rotations, shifts on the crisis line for the negotiators. So they learned and had a better understanding of what it's like to support a person entirely over the phone who is experiencing a mental health crisis, a suicidal crisis. And it taught us some of the things that they see and do and respond to as well. And so these relationships are really, really important before you even launch into that. Hopefully it won't take you guys all that long as it we had to go through. But again, I think it was just because we were slightly ahead of our time. Next slide. So I think that I'm hoping, I'm assuming perhaps that many of you guys are familiar um, with this infograph. It kind of like shows it's been around for some time and we've been using it as we've been building out crisis care continuum, focus on 988, etc. The idea here though is to show that if you have a person in crisis and they have now two options, they can call 988 or they can call 911. The paths after that differ. If you call 911 and you don't have 911 diversion in place, most often, it's going to be either a police response or an ambulance response. And after that, it may include hospitalization, it may include urgent care, it may include incarceration, even, right? But if a person in crisis calls 988 directly or gets diverted from 911, look at that number, guys. 98% overall in the entire network get in, resolved entirely over the phone or text or chat. Only a small percentage needs an in-person response. And rather than automatically having to go to let's call 911 and get police or an ambulance out, many communities have access to mobile crisis teams. We don't know. The reason that there's question marks on this slide, we don't really know yet, certainly in LA County, Southern California, what percentage gets resolved in the field, because even though we're really trying, we're working on all of these collaborations, the systems themselves don't necessarily match perfectly, making it a little bit hard for us to get at these outcomes. But a certain number of mobile crisis teams going out get resolved in the field themselves. Those that don't, usually people get diverted over to maybe respite centers or um, urgent care behavioral hubs, right? Specifically for that, not necessarily the emergency department. And those people later on can get connected to community-based resources. So all of this to say is that this is a really good illustration to show how important it is that 911 has that third option, right? It's not just police or fire. It can also go to 988. And that's kind of what we're talking about. Next slide. Uh, all right. So we're talking about crisis response. The logistics can be a little daunting, right? California, we're in LA. California, the population is 39.5 million. That is in, the most populous state. We have over 600 different law enforcement agencies. We have close to 440 PSAPs, so public safety answer points. So these are typically your dispatch centers. We have 58 counties. There's 11 988 centers in California. We don't even know how many mobile response teams we have. We're still trying to get at the total landscape. We're doing the best we can, working with the California 988 Consortium and our state partners to really get at those numbers, but it's changing all the time. We also don't know how, and my slide still says co-responder team, but following the guidelines earlier in our presentation, we heard let's call it collaboration, right? Collaboration responders. So collaborative responder teams. We also don't know how many there really are on that yet. Um, Doing a little bit, there's no way I could even start to look at this for the entire state, but LA County alone, we have a total of 65 hospitals that have a diverse number, a variety of number of psychiatric beds available. So this is a lot of things to keep in mind as we're trying to get a person to the right place, right? So logistics are challenging. And I'm not going to lie, it's going to take you time, no matter where you are, your county, your state, but certainly also just your local region to try and figure this out. Starting with a landscape analysis would be a good recommendation um, from me. Next slide. So this is a picture, an image of California and our many counties, and you can see there on the right. These are the counties. I mean the 988 centers who cover 988 for the state of California. We have always been a collaborative bunch going back all the way to, oh gosh, I think this was in 2012. We formed a different kind of consortium that concentrated on getting common metrics. But certainly since the start of 988, we now have the official 988 California Crisis Center Consortium. And this gives you kind of a bird's eye view of the area of coverage. It's because population density varies so much, I made it a point to put on this slide also the entire population covered by, for us, for DDHERS, for our primary coverage area, is close to 20 million people, which is a lot. So, and again, it involves a lot of PSAPs, a lot of law enforcement agencies, a lot of urgent care centers, et cetera, et cetera. Okay, next slide. So how to really get at the importance of these relationships, right? And I have a slide a little bit later that I will talk about a little bit more in detail, like what are the different phases of setting up a program for us with our various PSAP partners. Um, um, it's very important to get leadership on board, meaning leadership at the PSAP, at the law enforcement agency you're working with. And it is not enough for us to go into a dispatch center saying, hey, your chief of police totally supports this. That chief or maybe a commander or a captain, they need to be there at that training. Dispatchers really need to know that leadership has their back because ultimately dispatchers are placed in the position of making the decisions in the moment. And they really need to feel safe making those decisions. They need to understand that, and you have to work through your contract or MOU, that the liability is not entirely on them. We have to make sure that you look carefully at risk. There's various templates out there now for contracts or MOUs on how to do this. I want to say to you that though, for the ones that we're working with, everyone is a little bit different. So, and I think that that's also important because every region, every city, every locality, right, every community is different. And politics definitely play a part in this as well. So be mindful of that as you start to explore this. Dispatchers really need to understand what 988 is, and many of them don't. And even those who we are working with closely in Los Angeles Police Department and the LA Sheriff's Department, with whom we're now expanding this program, they may divert to 988, but a true understanding of 988 they still don't have. And so part of the building of the relationship and the trainings that we provide have a lot to do with what we as 988 centers can do and the training involved and the expertise involved, etc. Both need to understand that we have a different scope. We may have the same goal, helping people in crisis, but the things that we can do to support them are different. And understanding the scope has to be a key component of the training that you are providing to them. It has to make sense to everybody, right? It has to be like we, in our pre-planning phases, what we really are talking about is like, does this make sense to you? We do it a certain way, and we work like this with LAPD, but maybe you, Pomona Police Department, which is another one of our partners, maybe it doesn't make sense to you. You do things slightly differently. You use different codes, you do different words, you have a different organizational chart, right? It has to make sense, and both partners in this need to understand that about each other. And very important, starting from the onset, is that we have a program, we have guidelines, we have processes, everything is in place, but we are absolutely flexible and making adjustment as we move through the pilot phase. That's extremely important. We've done that several times now with the different PSEP partners, law enforcement partners that we are working with. What works for one didn't work for another. And so flexibility is really key, and it actually helps the dispatch team to really get more buy-in and more on board with this because they know we're listening to them, right? Oh, no, we answered the phone this way, and so we need to say this first. Okay, and then maybe we do it this way. So that's just an example. Next slide. A good view or image of how our scopes are different, but also how we ultimately have the same goal. Right? On the right, you see this is a very beloved person. He actually passed away a few years ago due to cancer. So we continue to use his image because we love him and miss him so much. That is Ken Denziger. He was one of our crisis line shift supervisors, long time. Um, and the warmest, most empathic person you can think of. You want to hear that voice on the other end of the line. And on the left there, you see Sergeant Chuck Coleman with LAPD. He's sitting next to this young lady and it's a little bit of an unusual image. She had been on an overpass, and he belonged to the responding team, and helped negotiate with her to get her off of that overpass and into safety. And while they were waiting for maybe her parents to arrive, that part I don't know all the details. They sat down right there on the ground together. She reminded him of his own daughter, same age, and he had a heart to heart with her. And it shows again the humanity of the first responders. And we love using these two images to really truly show ultimately we can do this together. Sometimes people need a law enforcement or fire response. Sometimes they don't. Ultimately, we have the same goal. Next slide. So part of our working together with 911, we constantly give them examples, and this is part of the training, like when should a person call 988 to begin with? And you can read this for yourself. These are just some examples. But one of the things that we've been doing in LA County, and we're now also doing that with Ventura County, is create cards that officers can just wallet cards that they can hand out in the community that very clearly say when you should call 911 and when you should call 988. And that builds, again, that's that grassroots stuff that I'm talking about, boots on the ground, that builds awareness and a better understanding of what 988 can do. Next slide. Um, Very important. This is what happens. This is part of not just our trainings for 911 dispatchers and their leadership. This is also what we constantly preach out in the community. There's a lot of misinformation about 988, and we have to continue to correct that. And so we make it really very clear what's going to happen. Yes, we're going to ask some questions. You don't have to answer those if you don't want to. But this is very important understanding for those who, like dispatchers, who are not as steeped into crisis care, mental health, behavioral health as most of us are, right? Next slide. All right. So this is our process. I'm going to I need to pause here and give a moment's credit to, I now don't remember the name, um, Portland, Oregon's county, I think it's Multnomah County. Um, they at one point, the county, not the city, the county it had some sort of a DOJ junction on them. I forget exactly what that was, but they were told they needed to do a better job getting people in crisis, and therefore working or supporting them, and then therefore working with the local call center. And and this is a slight adjustment on the initial criteria that they came up with. Because when I started working with LAPD and we determined co-location was not the way to go, and for those of you who do not know what co-location model is, co-location model for 911 diversion means that you have 988 crisis counselors located inside the dispatch center. That's great for counties and areas where you have large centralized centers like that. You saw earlier how many different entities we're dealing with in LA County alone. It simply wasn't an option for us. It's not really feasible. So phone warm transfer made sense. Um, we knew about this program, and so we took and ran with it. So we're not going to reinvent the wheel either, right? These are the four exclusion criteria. If a person needs medical attention, if they are on a structure or a bridge or a tall building in a public area, if they have a weapon, and we're talking primarily about something like a firearm or a knife, uh, and are in public and others are present, and or if they have a weapon are inside their own residence, but other people are present and could potentially be heard. Okay. If the answer to any of these questions is yes, don't transfer. We try and make it as clear as possible. And as you develop these with your own dispatch centers, gray does not work for dispatchers. I've been told that over and over again. It really needs to be black and white. This is extremely important to make it as black and white as possible. We had a different criteria that seeped into it, both with LAPD. At one point, I noticed that, and with the sheriff's department that said, or suicide attempt in progress. To me, that's a gray area because what I think of as a suicide attempt in progress, uh, and now I want to quickly hint to something called risk tolerance, which my colleague Shaheen and I learned about at the NINA conference last year in Long Beach. This idea of um, a 988 crisis counselor. And for those of you who have ever taken an assist workshop, you're familiar with one of the exercises in the assist workshop actually has a scenario that is a crisis line. Counselor picking up the phone and hearing a shotgun, right? For most people who are not in the crisis center world, that's an immediate like, I panic, I need to call police, I need to get 911. That's happening. For a well-trained 988 crisis counselor, we're going to try and work with that. That's that's an important difference, and that's an important understanding for 911 dispatchers as well, what we can do. Okay, next slide. I know that this is not easy to read, and I'm just putting this up here to show you that we created this flow chart with LAPD to really truly help the dispatchers understand, like if a call comes in, and if it's a certain type of call, and I can name the four codes that they're, well, not the actual number, but the four types of calls that they are using to determine, hey, now I need to think about 911 diversion. Can this go to DDoS? Those are calls there where they're thinking it's a suicide attempt or a possible suicide attempt, mental illness or a possible mental illness. This is just their words, their coding, their categories that they use. Once that's been determined, then they're going to assess eligibility. You saw those criteria already. And again, if the answer to the exclusions are yes, any of those, they're not, no, we're not going to send this over to 988, but LAPD has a co-responder team. They're called SMART teams. So this is a clinician going out with an officer, very well trained. Um, they are now being dispatched together at the same time as patrol. Patrol usually gets there first. This just goes to show you how there's follow up. We have safety need control. Like if it ends up, we need somebody to respond, perhaps it does require law enforcement. We have a direct line back into the dispatch center that our shift supervisors can use while the 988 crisis counselor just stays on the phone and continues to provide emotional support and de-escalation. Okay, next slide. Just a few highlights. Um, we're now almost, I have to count, we're almost 5 years into the program with LAPD. And we are basically, this is our average right now. 90% of all the calls that they divert to us do not need any sort of emergency response or immediate in-person care. Of those that do, ultimately less than 3% require 911 support. The vast majority we end up supporting through either mobile response dispatch or connecting them with mobile response or coming up with a safety plan for now my friend is going to take me to urgent care, to a respite center, etc. Um, one thing we were very surprised to learn that there are some significant demographic differences between the calls that we get from 911 versus those who call 988 directly. That has to do with age groups. In particular, we get more older people, which is really good because they're our highest risk group for suicide through 911. It also teaches us, oh, that's where we need to go and do more outreach with. Gender, we get way more males through 911 diversion. Very interesting, completely not expected outcome. About 70% of, I think at the moment, it's about 70% of all the calls that we get from 911 diversion are males. That is not at all what we see on 988 directly. That's more 50-50, roughly. And then race and ethnicity, also an unexpected outcome. We see more people of color coming through 911 diversion than directly through 988. And this is particularly true for African Americans. So the African American male, right, we would think that they are not as likely to call 911 to get a police response. Actually, those are the ones that call 911 and then come to us. We're working currently with USC School of Social Work to do an evaluation research study to look at some of these outcomes, and I'll keep you posted on those whenever we get to them. Um, and the other important note to talk about is that, and this gets to the heart of the matter, these relationships, that's like a full-time job plus. You need to nurse it, you need to nurture it, you need to continually feed the relationship with the PSAP, the dispatch center, the law enforcement agency you're working with. Because what we notice every time we see volume increase of diverted calls after trainings, after roll call visits, after sit-alongs. These are all constant reminders of our presence, teaching dispatchers, building trust, et cetera, et cetera. Next slide. So I'll just read a few case studies just to highlight. This is just a quality before I move on to the final piece. This is a call we received. This is Elle who called feeling threatened by unknown individuals who came into her home, destroyed her property when she was not there. And this was a frequent occurrence. And so she actually was a frequent caller of 911. She felt nobody believed her, and she had a hard time controlling her anxiety and suicidal thoughts. So that call was diverted to a 90-day counselor, and that to her made all the difference in the world. She wasn't familiar with 988, but the counselor listened to her without judgment. That is what they're trained to do, help calm her, and provide a follow-up call, which is one of the things that we do with all of the PCEPs that we're working with. We offer a follow-up call to all the diverted calls that we get from them. Not always accepted. We can always reach them, but we absolutely offer it 100% of the time. So at the time of that follow-up call, she was able to engage in safety assessment and planning, which was great. She got new resources she wasn't familiar with, but she was especially grateful for having the number to give to her 21-year-old son, who was who was really her main source of support. And it was hard for him supporting his mom through these various crises. And it goes to show you also how important 988 can be for family members and friends, third-party callers, as we call them. Next slide. This one came early on. It was very interesting. So this was a dad who called. He has a 6-year-old daughter who was terribly upset, was actually talking about wanting to die, and he did not know what to do. And he called 911 because, again, we call 911. It's an emergency, right? Thankfully, they did not send a police response. They sent her to us, and a crisis counselor provided resources to the dad, and like normalcy a little bit in the crisis, but also was able to do breathing exercises with this little girl over the phone. And so the outcome for this family was so much better than if a black and white with sirens had arrived at their doorstep. So gives you just a little glimpse into some of the great calls, great outcomes that we can get from this. Next slide. So what does it take for this to be so successful? I've already talked about the fact that it is all about relationship building. So even before you do any of this stuff, you got to have the relationship in place. But early on, just a few bullet points, make sure you have to address technology, interoperability. You need to make sure you have union support. You need to make sure you have leadership support. Again, I already mentioned that boots on the ground, they need to actually physically be there. Lots of community outreach and education. It's almost a separate thing, but we're if people call 911 and they're being told, I'm going to send you over to 988, and they have no idea what 988 is, they're a lot less likely to engage in that. So we really need to do that hand in hand. We have to understand that there's, and address the difference between 911 dispatch and 988 crisis line cultures. We need to talk about what it takes, or why would a dispatcher be hesitant to send a call to 988? Again, it has to do with building trust. Um, it involves lots of trainings, lots of site visits, ride-alongs when possible, listening into call, doing debriefing sessions. Our coordinator is often at the various dispatch centers to just sit there, listen in on 911 calls. And then be able to answer questions about 988 so that we get a better understanding what each center does, and how it differs and how it's the same. Um, okay, next slide, because I know I'm running a little bit late on time. Okay, so this kind of gives you an overview of how we go through this. So we're pretty proud of this. I have to thank Shaheen particularly for this, because this was sort of her vision. It's very challenging to do 911 diversion without funding. And prior to uh, me being able to bring on board Shaheen and a 911 diversion coordinator, I was it. But this was not the only program I was overseeing. And it takes a lot of, again, that nurturing, that nourishment, that constant strengthening of relationship, right? And it definitely was faltering. So if you are going to do, if you're thinking about implementing this, and start with one dispatch at a time, or if you have some and it's not working very well, because we know that we're hearing that there's a lot of programs like this that are being started, but they're not really getting high numbers. And to be truthful, I don't think our numbers are nearly as high as they can be. So we're going to have to continue to work on that. But in order to be able to do this, we needed money. We needed more money, and get people to understand it's not about the number of calls that additional calls that maybe 988 answers, because that would be, then you're just looking at, um, you know, butts in the seats, right, for crisis call centers. But that's not what it takes. That's just a really small part of it ultimately, because the infrastructure is in place to handle a variance in call volume. What is really, where the resources are really needed is this work right here. And so having a visual like that is going to be very helpful for you to secure funding or to show that funding is needed in order for this to be a successful program. So the phases that we're looking at is we start with consulting. And once we've gone through all of that, which you can see here actually does include talking about funding, and we're also going to work with them to develop an return on investment, like how much money do they save if they send a call to us, and what does that look like? And remind dispatchers of that too. Hey, if you send 10 calls to the center, this is how much time, resources, and therefore dollars are saved for the police department that can go elsewhere. All of this is important because money talks, right? Once we're through the consulting phase, we move on to onboarding. This is where you want to make sure that you have a solid MOU or contract with scope of work or statement of work being part of it, a true understanding of those. I just showed you. We have the exclusion criteria in place, but for some law enforcement agencies, those don't work or they need to be slightly altered, right? So really work in this phase. It's really about, does this all work? Work on the training together. We do not do the training for the dispatchers ourselves. We work hand in hand with the department itself. So for LAPD, our primary partner there is MEU, which stands for Mental Evaluation Unit. It's a very large department, and they've been really our true partners in this. And for the LA Sheriff's Department, we work with MET, MET stands for Mental Evaluation Team, I think. I'm trying to remember. LA sheriffs and LAPD often they just kind of quibble with each other. That's par for the course, sort of competition, friendly competition. Um, but it is very important that in my mind, if it's at all possible, you train with people who belong to the dispatch center, who belong to communications or whatever department is most appropriate for you to work with, and you train together. That is extremely important. I would highly recommend that. Talked about working out the technology, et cetera, et cetera. Implementation phase. During this phase, we meet weekly in the probably for the first 3 months. We this is really important. We check in on calls that were sent. We discuss them. It may feel like a lot, but without them, program will falter. We look at the data, we make sure everything is working as it should. We look at things that calls that were diverted that shouldn't. We look at outcomes, et cetera, et cetera. And then eventually move into the maintenance phase, which really and truly continues to be that nourishment, that nurturing that I've been talking about all along. You have to maintain these relationships and keep them strong. It means they can come and visit the crisis center. They come and they have a booth at our annual fundraising event and vice versa. We show up together for various events in the community. That partnership is extremely important, and keeping that alive and keeping that strong is what ultimately can make or break the success of a 911 diversion program. Next slide. I put this in here because this for LA County, very close partners and also funders for us is LA County's Department of Mental Health. And they created a program or a department for alternative crisis response. We totally borrowed that name, and Shaheen is our director, our assistant director of alternative crisis response. We're building that out, not just to be 911 diversion, but also for mobile response dispatch, respite centers, etc. And I love the way that LA County Department of Mental Health put that in words, right? This is their vision. Individuals experiencing a mental health crisis in our county are treated quickly, effectively, and with empathy at the least restrictive level of care to meet their short and their long-term needs in the system as appropriate so that they can remain in the community. And we know that ultimately that is better outcomes for everybody. Next slide. Um, Even though we've been focused primarily on the first pillar of the crisis continuum, right? I I want to I purposely put this slide in here as well because we do not just collaborate back and forth with 911. It's with all of the different crisis care facilities. It could be respite centers, it could be short-term residential, um, obviously hospitals, urgent care, and then all the community resources out there. This is not exhaustive. I just put some, arrows in here to show how this may work. But ultimately, this is really what a true non-siloed, well-organized, no gaps existing system should look like. We're all helping people in crisis get to the right kind of treatment, the right kind of care, and be able to live fulfilling lives, right? That means we have to work together across all of these systems, across all of these agencies. And if you're in LA County, where we have almost 10 million people, that may be a little bit more challenging. But it's also challenging in more rural counties where resources are more scarce. And, you know, here the houses are all put together, but they could be many, many, many miles apart, and it makes collaboration harder, but therefore even more important. So keep this vision in your head as you move forward. Next slide. So I kind of had this utopian idea of like we're all working together, no silos, and there's no gaps, but they do exist. And so these are some of the things that we continue to work on to ensure that the collaborations that we do have in place are successful. We have to look at what are the gaps. Um, one of the um, one of the not so great parts of my job, in my role, I co-chair LA County's Child and Adolescent Suicide Review Team, where we look at all the suicides um, by children in our county, and we do that with a team of subject matter experts, and we really truly do that so that we can understand why did this happen? What was missed? What systems do we need to change, right? So constantly looking, constantly evaluating is extremely important. The that dispatch hesitancy, that will be ongoing because they rotate. I was going to have a partner here from LAPD, but they just actually had a big rotation of staff. So the people who were in the best place to support me in this presentation are actually now in different roles. It's going to continue to happen. So it's really important that you understand. Therefore, ongoing trainings, ongoing connections, ongoing meetings, ongoing things doing together, et cetera, et cetera. Um, Follow-up care in our county is complicated. It is extremely important that it happens because gosh, I think we need way more system navigators than there exists, right? It can get very challenging. And if I'm already uh, dealing with cognitive impairment because I'm not doing well, it's even more complicated. Follow-up care, I would highly recommend this is when you go beyond just 911 and 988. You look at all your crisis partners in the community and see if you can come up with a more, collaborative plan. Um, I highlighted more community outreach and education because it is such a big need. It doesn't matter. You can have all kinds of big billboard campaigns and et cetera out there. People will not know or trust 988 and understand what it is if they're sent over that way unless we are out there pounding the pavement. It is extremely important that we continue to do this very, very important grassroots work. Um, there's more gaps. We, for example, at DD Hers, we are not necessarily able to do direct dispatch for mobile response teams. And because we have, gosh, we're dealing with around 80 law enforcement entities in our county alone that have their own dispatches. Um, some cities have lifted their own teams, which is fantastic. But the only way for those teams to get actually mobilized is by people calling 911, which kind of goes against the grain. So we really kind of need to find a way for 988 to have more direct connections, closer connections with the many options that are out there for dispatch, right? I cannot say, hey, LAPD, I think that this is a crisis, but I don't want patrol to go out there. I think it requires a co-responder team. I can't do that. I have to go back through 911. And so those are the kinds of things that it would be really great if we have access to see, oh, you know what? Wait time for this response team is going to be 5 hours. That's not going to be okay. I'm going to connect you to this one. Or don't go to this hospital because they don't have any beds available. And then you're stuck there and you need to be wait to be transported. And then it becomes an involuntary hospitalization, even though you went there on your own accord. It gets complicated. And so again, this is exactly why working with all the people, all the agencies in your service area are so extremely important. We also don't have secondary PSEP. So secondary PSEP usually means fire. Yet fire certainly LA Fire was very much involved when we first started talking with LAPD. They were at the table because they were super interested. They often go out because they do the ambulance service to mental health, suicide-related calls and end up not transporting patients or anything like that. And they would love the ability to divert calls over to 988. We haven't quite cracked the code of that yet. We don't know how to do that yet. And it's not happening and it's a little bit more complex, but that also should happen. Dedicated funding, I started that presentation with that. We still don't have it. We have funding from LAPD and we get some funding from the Department of Mental Health. And that's basically it. So it's very challenging to make these programs successful without dedicated funding. It's a huge gap. It needs to happen. One of the things we're currently working on, I didn't think about this when I first developed the program, but I wish I had, is creating a community advisory board. We think this is what the community wants. They don't want police to respond, right? But is that really true? So I want to make sure that that is the case. And in order for us to really do a thorough evaluation and having the community be on board, we need an advisory group, and we are starting the process of building that one out. Next slide. And that was it. So thank you.